My name is Alicia Montoya. I'm the district manager and tax administrator for the 19 Pueblos district. I see some familiar faces in this audience, including our governor, Governor James Naranjo. Thank you so much for coming, Governor. But I do see some new faces. And anytime I get in front of a crowd where I get to talk about the 19 Pueblos district, I will do so. And so I'm going to bend your ear for a moment and talk to you about the 19 Pueblos district. Who are we? Well, as you know, this is the Indian Pueblo Cultural Center. You've heard of Indian Pueblo Marketing and the Indian Pueblo Entrepreneurial Complex. But around 12 years ago, Pueblo leadership came together and they saw the need to have a government here on their federal trust land to do oversight and to ensure the development here abides by certain laws and ordinances. And so they created a very unique structure, a structure unlike anything in the United States, unlike anything in the tribal nations. And basically what it is that the 19 Pueblo governors sit as our governing council. And they are the ones who are the authority over this land, over these 70 acres. And they install the laws, do the decisions for it, and I meet with them every quarter. Under them are my 7 commissioners who I meet with monthly. And those 7 commissioners are appointed by the governors, 3 by the northern, 3 by the southern, and 1 is commissioner at large. And then the staff is myself and Kyle Chicharillo, who is our executive assistant, and that's it. That's our government. And how do we do this work here? Well, we work in collaboration with the Indian Pueblo Marketing and Indian Pueblo Cultural Center. And I meet monthly with Monique Fraua. And we have wonderful discussions, vigorous discussions. We laugh a lot every month. And it is the government and the business working together hand in hand to ensure that we're working on behalf of the 19 Pueblos. And what does the government do? Well, like I said, we have ordinances. We have a liquor control ordinance. We have a business registration ordinance. We have food safety, completely different from the city of Albuquerque. And we also have a cooperative tax agreement with the state of New Mexico. So I collect taxes and fees and everything. And what do I do with that? Well, through the leadership of our Pueblo governors, we give it out equally to the 19 Pueblo communities. And so everything that is done here is given back so that the Pueblo Zia, Okewinge, Zuni, they have a foothold in the Albuquerque market and they get money back from the lands of their ancestors, their ancestral lands. And so every time you come here, and we encourage you to come back and enjoy everything here. The hotels, they're very safe. We have a wonderful security force here. The 12th Street Tavern has some wings. Go to Vitality, has some fresh pressed juice. Go to La Montanita, get some groceries. Every time you do that, you're giving back to the 19 Pueblos. And what do they do with that money? Well, it's their money as they see fit. I'm not giving them a grant. This is their money. And they build roads, they do elder care, child care, college scholarships. So everything we do here is giving back. And it's an honor, and I'm grateful to be a public servant to these 19 Pueblo communities. And how do we get here today? Why are we here doing RECA today? Well, the other thing that we do is the Pueblo Administration Collaboration Summits. It's another way that back last year, we decided, Kyle and I, to give back in another way, not just financially, but to bring Pueblos together. Because all the Pueblos are in different spaces throughout New Mexico, and sometimes they don't be able to get together to have those important conversations and to share knowledge. And it's hard for them to get to Albuquerque to get the resources here. So we host those meetings. And at the last meeting, we have the New Mexico Department of Health. Thank you, Kaylee, for being there. And they talked about RECA. And we heard a lot of information about the need for that. And so as soon as that meeting was over, we began to put that into place to have this meeting here today. And we reached out beyond the Pueblos. We wanted to reach out to the tribes and the nations as well, because this affects so many people. And it is an important moment to be able to do that. And I really want to give a shout out to Kyle Chicharillo. He was instrumental in putting this together so seamlessly. And so thank you so much, Kyle, for that. You should, and if you don't, we have an agenda. It's in the front there. You can always step out and grab an agenda if you'd like to see who's going to be presenting today. And, the people coming here today, I am just honored to have them. As you can see, they are truly people who gave their time and their energy and their commitment and their talents to ensure that there is compensation for this tragedy, I can't say the word, it's so emotional, this unfortunate event that happened here in New Mexico that claimed lives and victims and has impacted generations here in New Mexico. And so you'll hear from Ms. Tina Cordova, who will speak to the history and the facts and the data and her personal experience, and it's through her and her team, her advocacy, that we are brought here today, and it shows like how community organizers make a difference, you know, in the state, in the nation. Ms. Fraser, Ms. Schaefer, and Mr. Fernandez from the New Mexico Department of Health will address frequently asked questions of RECA, and, you know, there's a lot of scams out there, there's a lot of issues, and so the New Mexico Department of Health is here to address those big picture items. Ms. Gina Grimes is going to touch upon uranium workers and the RECA application, so she's going to touch a little bit on both because those affect people and certain personnel in different ways, and so that's important to understand the difference between those two. We also have Ms. Terry, who is the branch manager of special collections at the library. And this is really interesting because as you go through this application, you have to prove you're in the state of New Mexico. And that may seem simple. You know your families, you've been here forever. But as far as documentation within the Pueblos or the tribes, or even like in rural northern New Mexico, rural southern New Mexico, it's really hard to figure out how to prove that you're a family member or you were here during that specific amount of time. So special collections at the library is here to address that issue as well. And we also have Ms. Anderson and Mr. Montoya from the New Mexico School of Clinical Law, and they're going to provide some valuable step-by-step information about the application, because if you've looked on the application, it's very intimidating, and they're going to be able to walk through that with you. And they're also willing to go out to your communities to talk one-on-one, to have that like a case manager experience with them, and that's just an amazing ability to do that. So we hope everyone here today gains some valuable, practical, and even life-changing insight about this application, and our goal is to provide resources and knowledge that empowers you and your families going forward. And for those who are unable to attend today, this is being recorded by the City of Albuquerque, so I'm very grateful for the city to join in this endeavor. Special shout out to Brandy Ami, who's just an amazing tribal liaison with the city. I really enjoy working with her. Of course, Yvette as well, thank you for being here. And so that's going to be recorded, so if you can go back, because there's going to be a lot of information you can refer back. It will be posted on the website, and please share this wide with everyone you know. And because this is something that was long overdue, this compensation for what happened, for this tragedy that occurred here in the state of New Mexico, because the citizens of this state were the first victims of this nuclear bomb. So we are happy and we're grateful to be able to host this important meeting. And again, we hope that you gain a lot of knowledge from it.
Good morning, everyone, and thanks for joining today. I'm hoping that we'll be able to share quite a bit of information with you all that's new, but more than just new information, I hope it's information that will inspire you all to go back to wherever you have come from, to encourage people in your community to apply for this compensation. Not only because we deserve it, but because it's a life-changing amount of money for many, many people. And just to encourage that along, let me just say that as of last week, and we haven't checked this week, they have approved over 550 claims in New Mexico. That's $55 million, just downwinder claims, $55 million. They have over 4,500 claims pending. That's $450 million. They have only rejected 3 claims in New Mexico so far. And those people did not meet the qualifications. It wasn't because they didn't submit properly, they just didn't meet the basic qualifications. And so I hope that that will encourage you. For years I've been saying, we're not going to bring millions of dollars back to New Mexico, we're going to bring hundreds of millions of dollars and potentially billions of dollars. And we're on track to do that, folks. They're receiving about 900 downwinder claims a week, and they're only approving about 150. And just so you know, the law states that if they don't adjudicate your claim, if they don't review and make a decision about your claim, within 1 year of issuing you a claim number, your claim is going to get processed and you will be approved. I want to, before I get into the presentation, acknowledge a couple of things. Alicia and Kyle, you all have been amazing to work with. We have a great planning committee that's been working for weeks to plan this. All of you participated in that. I want to thank you. This is very important that we bring this information back to our Pueblos and tribes. But it has been a joy to work with Alicia and Kyle. Kyle has done a fantastic job. I told him yesterday I do a lot of these events, and he's been on top of all the details like no one else. So thank you, Kyle. I also want to thank the Indian Pueblo Cultural Center for having us here today. It's wonderful to be in this beautiful facility. For those of you who haven't ever eaten at the restaurant here, it's probably the best food in Albuquerque, so encourage you to come back. I want to thank the governors who are supporting this effort, the governors from the Pueblos. It's important for you to support this effort so that everyone in your community understands the importance of doing this. So I would highly recommend that everybody get on board with this process again so that we can bring back billions of dollars to the people of New Mexico. I want to acknowledge Phil Harrison. When we started this work, people didn't understand or know anything about it, right? And we landed up forming not just a statewide coalition and a national coalition, but an international coalition. And my brother Phil from the Navajo Nation has been working on this with me for, gosh, I don't know, more than 16 years. And so Phil, I always appreciate you and everything that you do within your community and everything that you've done for the people of New Mexico in fighting this battle with us. The first slide that I have is basically the logo for the Tularosa Basin Downwinders Consortium. I'm just going to call it the TBDC for short. I want to tell you a little bit about the organization. We founded this organization 21 years ago. We've been doing this work for 21 years to bring attention to the negative health effects suffered by the people of New Mexico as a result of them being overexposed to radiation from the Trinity bomb. Little did we know at the time that we were not only downwind of the Trinity bomb, we were also downwind of the 93 explosions that took place in the desert of Nevada. And I'll talk a little bit more about that later. We also learned, after starting this organization 21 years ago, that there had been a fund established in 1990, so 36 years ago, to pay compensation to people who lived downwind of the Nevada test site. Imagine, they were paying people who had suffered and sacrificed the same way we had, but they had never included us. And we were the first people exposed to radiation any place in the world as a result of an atomic bomb. And we were left out. And so we started an organization to bring attention to this. We're a structured organization. We have a steering committee. We meet every Monday evening, almost without fail. I want to recognize that two of our steering committee members are here with us today. First, Bernice Gutierrez, and then Paul Pino. We're volunteers, folks. None of us get paid for doing this work. We have traveled all across the nation doing this work. We have gone countless times to DC to lobby, and we have traveled on our own dime. And so I just want to acknowledge that this work is a team. There's a team behind the work that we do. And it has been a team effort, and these people need to be recognized for the work that they do. I also want to ask Michelle, who I own a business. The way that I used to have a friend that would say, the way I buy my daily tortillas is that I also own a business. So I actually am a roofing contractor for 36 years. And Michelle, right here at the table, works at my business. But these days, 75% of her work is dealing with the calls coming in about RECA. We probably receive about 100 calls a week at our office. She's helping countless people, and I wanted to recognize Michelle for doing that hard work, but also because she can be a resource for you guys as you move along through this. I've already acknowledged our steering committee. We have members from all across the state, from Chama all the way to Las Cruces, and so we have a good profile of people who can bring back to us the issues they're facing in their communities. Here's a picture of us in Washington, D.C. for a trip we made to lobby there. Again, speaking to the fact that we have traveled all over the place to do this work. So my objectives today are pretty simple. I want to tell you guys a little bit more about the qualities of the Trinity bomb and why it overexposed us to radiation, how our lifestyles set us up for or predisposed us for a really awful outcome with an atomic bomb. I want to talk about the multi-generational component of this and the fact that we lost babies in record numbers after Trinity. And I want to talk about how we worked for 21 years to get this to happen. And then I'm going to talk about RECA, what it is, what it means, what it does, and then we'll be done with the presentation. So the unique characteristics of the bomb, some of this you may know and some of it you may not, but it's a little bit important to understand. It was the first time our government conducted a test any place in the world, right? And people oftentimes tell me, Tina, they didn't know what they were doing. Nothing could be further from the truth. They knew exactly what they were doing. They were creating a weapon of mass destruction. They were going to test it someplace, and they chose to test it in the desert of New Mexico. They knew that radiation was dangerous to human health. That was a well-established fact. And furthermore, they did a pre-test of Trinity in May of 1945, where they took 100 tons of conventional explosives, laced it with radiation, and detonated it out at the Trinity site. Why did they do that? Because they wanted to see what was going to happen with the fallout. And what happened? The fallout went all over the place, and they traced it, they tracked it. So they knew when they detonated the bomb at Trinity that it was going to disperse radiation all over our state. They also had parameters where they said, we will not detonate the bomb under these conditions, and one of them was that they would not detonate the bomb if it was raining. Well, the history is that it rained very, very hard the evening of the Trinity bomb, and there was a break in the weather. The bomb was supposed to be detonated overnight. The weather broke early in the morning, and so at about 5:30 a.m., they decided to go ahead and detonate the bomb, and they did. And we had some of the heaviest rain that day after the bomb was detonated. The other thing that they didn't know was how much plutonium will it take to cause this explosion. So they overpacked the bomb. It was incredibly inefficient. They put 13 pounds of weapons-grade plutonium with a half-life of 24,000 years in the bomb. Only 3 pounds were necessary for the fission process, which means 10 pounds went up in the fireball that they say estimated to have traveled over 50,000 feet past the atmosphere, penetrating the stratosphere. Once that radiation got into the stratosphere, it went around the world, folks. But one of the things that also happened is that the bomb produced more heat and more light than the sun, 10,000 times the heat of the sun. It incinerated everything in the immediate vicinity, the dirt, the sand, the animal and plant life, created that fireball that produced an enormous amount of fallout. The ash fell for days from the sky and got on everything. Why is that important? Well, I'll talk about that in a minute, but the oral histories that we've collected throughout the time doing this work, people have told us that one of the things they remember was, number one, the concussive force of the bomb, which knocked people out of their beds, broke windows, cracked walls, okay? But they also remember for days afterwards an ash fell. In 1945, because we didn't have electricity, nobody had air conditioning. So what did people do? They left their doors and windows open, and they hung wet bed sheets in their doors and windows to create a cool draft through their homes. And people have told me that in the days afterwards, they had to take down those sheets, rinse them out, and hang them up constantly because the ash was creating this film on those sheets, and the sheets were basically black with ash. All of that was getting into people's homes. Here's a photo taken of the bomb immediately afterwards. You can see the big mushroom cloud that kept ascending. And let me tell you something, they learned at Trinity that to create destruction, because Trinity didn't create destruction, it created fallout. They never did another test like this because of the fallout. They realized that they had so overexposed people to radiation. So the bombs in Japan, just to give you an idea, were detonated at 1,600 and 1,800 feet respectively. And those bombs, the concussive force of those bombs came down and then went out across the earth. Trinity came down, intercepted the earth, and then took all that stuff up to create the fallout that came down on us. So how did this affect us? Well, our lifestyles set us up for a terrible outcome. Number one, we didn't have running water in most of the villages of New Mexico. There was probably running water in most of Albuquerque and Santa Fe, but in the village I grew up in, Tularosa, there was no running water. So what did we do for water? Well, we collected it in cisterns. There's still cisterns in parts of Tularosa. We collected it off our rooftops into cisterns. Those were enclosed spaces where we held water, and water was precious because nobody could turn on a tap and get water out of a tap. And we depended on our acequias. Tularosa, where I'm from, has the largest acequia or ditch system in the whole state of New Mexico. We had holding ponds. In Carrizozo, which was 35 miles from ground zero, they actually had a holding pond, and that was north of town, and people would walk there every day and collect the water that they needed. So water was precious, and now all of our water was contaminated because that ash became part of our water. We didn't have electricity into people's homes in 1945. Our government hadn't invested in that kind of infrastructure, and that didn't happen until after the war. So we didn't have refrigeration, no grocery stores. There were mercantile stores, and you bought things like sugar, coffee, flour, rice, cereal, but you couldn't buy dairy, you couldn't buy produce, you couldn't buy meat. All of those things were produced by your family and by your own means. We had cows and pigs and chickens, and we grew all sorts of fruits and vegetables. Now all of that was contaminated because the ash became part of the soil and part of the food chain. There's 3 ways you're exposed to radiation: inhalation, and as that ash is falling from the sky, you're breathing it, and now it gets into your lungs. You only have to inhale 1 particle of plutonium with a half-life of 24,000 years. It remains in your lungs for the remainder of time. It's decaying there, it's giving off radiation, it's irradiating your cells, and eventually you develop tumors. There's also another way that you are exposed to radiation: ingestion, and I described that very well. It was in our water and our food. But one of the routes that people don't talk about that often is absorption through your skin. And if you don't have running water, you don't bathe as often. So people bathed weekly. If, in fact, you were present in those days afterwards and that ash fell from the sky and it got on your scalp or on your skin, it likely stayed there. You were absorbing it into your body until the time that you were able to bathe. We were never warned before or afterwards, no warning. And when they detonated the bomb, they lied about it. They said it was an ammunition dump out at the Alamogordo bombing range. No one was harmed, nothing to worry about, nothing to see here. Go about doing what you've always done, which essentially was poisoning ourselves. So we have this really horrid overexposure with no warning, no way to take care of ourselves. I put this picture in to emphasize the fact that you can see Sierra Blanca, White Mountain, which is on the Mescalero Apache Reservation. That was the source of water for so many people, snow-capped. And then there's photos here that I shared of grapes growing and pecan orchards, all things that existed in 1945 and still exist today. So what are the documented effects of all of this? Well, I'm going to talk first about the babies that died that summer. Bernice was born 8 days before the bomb in Carrizozo, 35 miles from ground zero. 8 days before the bomb. She was a baby, an infant. Her mother was not warned about taking precautions. Women, just like all mammals, concentrate the radiation in their mammary glands. So every mother that was nursing a baby that summer was adding to the poison that the baby had already received. Bernice has done amazing work. She's looked at every death certificate available to us for children under the age of 1 in New Mexico in 1945. And what have we found? We found that we went from losing around 30 babies per 1,000 to losing over 100 babies per 1,000 that summer. Not all of our babies are documented. And why is that? Because they were born at home. And if they were born at home that summer and their births weren't registered, their deaths were not registered either. But we've heard horrendous stories. When you read through those death certificates, it's heartbreaking. The number of babies that were stillborn, the number of babies that were born with congenital malformations, some described horribly. The number of babies that died because their gastrointestinal tracts, their stomachs, couldn't function properly. They couldn't keep anything down, and they were doing everything they could to keep them alive, but nothing was working. In my family, I'm the 4th generation to have cancer since 1945. I had 2 great-grandfathers alive at the time in Tularosa. They were living off the, living off the land like everyone else. And in 1955, both of my great-grandfathers were told they had stomach cancer. We'll never know because there was really no diagnostic process back then. They were given morphine and sent home to die, and they did. They suffered a great deal, and then they died. Both my grandmothers, who were alive at the time of Trinity, developed cancer. My dad, who was a 4-year-old child dipping water out of the cistern, drinking mass quantities of fresh cow's milk, developed cancer of the tongue twice. 2 primary cancers of the tongue, which is unheard of. My dad didn't drink much, didn't smoke, would have never put chewing tobacco in his mouth, and had no viruses. And when I asked the oncologist, how in the world does a man get oral cancer twice without risk factors? And the doctor told me it doesn't happen, but we see it all the time in New Mexico. In between those 2 cancers, my dad had prostate cancer, which was a walk in the park after what he went through with the cancer of the tongue. I have 1 sister. She's had cancer. My mom's being followed for a parotid tumor that so far is benign. I have 2 brothers. My youngest brother was diagnosed with kidney cancer 18 months ago. His daughter, at the age of 23, was diagnosed with thyroid cancer, the same cancer that I had. We don't ask if we're going to get cancer, we ask when it's going to be our turn, because I'm sorry to tell you folks, that's the history of the state of New Mexico. We have the genetics for this now. We carry the genetic footprint. Bernice always says, this is our past, our present, and our future. When they detonated that bomb at Trinity, and then they detonated those bombs in the Nevada desert, we were forever destined. This is the legacy left behind for us. My family's not unique. 19 years ago, I developed a health survey. We've been collecting them for 19 years through a voluntary process, and we've documented thousands of families just like mine, displaying 4 and 5 generations of cancer. Bernice's family has the same history. Paul's family has the same history, and on and on. So we started this organization to bring attention to all of this, and we organized locally, nationally, and internationally. In the beginning, no one wanted to hear this. No one believed it. No one wanted to engage with us about it, but we continued this work. This past Saturday, we had our 17th annual candlelight vigil in the village of Tularosa. We light a luminaria. On those luminarias are names of people who've died. That community is a community of about 3,200 to 3,500 people. We read over 900 names, people who've died of cancer. These are just people that somebody has come forward and given us their names. I always say if we went door to door in Tularosa, we wouldn't light hundreds of luminarias, we'd light thousands. We call out each of their names. We decided long ago to bring attention to this. At least once a year, we would acknowledge all those people that our government long ago forgotten. So we've formulated partnerships with other organizations that are like-minded, and we worked very, very hard to get RECA expanded. I mentioned already our partnership with Phil and the uranium workers from the Navajo Nation. We also worked very closely with the uranium workers from Laguna and Acoma Pueblo. This kind of work is not easy work to do, folks. It's been tough. We've traveled from Santa Fe to lobby, to DC to lobby, and we've met with even the White House. When President Biden was president, I had an opportunity to go to an event with Senator Lujan, and I got to meet President Biden. And it was pretty interesting because everybody wanted a selfie with him, and I told him, I don't want a selfie, I want to talk to you about something very important. And there's a picture of him with both of his hands on my shoulder as I told him this history quickly about how we had suffered so much in New Mexico. And after we met with him and all of that happened, he wrote a letter of support for the Radiation Exposure Compensation Act, and no president had ever acknowledged our sacrifice and suffering or written a letter like that. I've testified in 4 congressional committee hearings about the need to expand RECA. It's been an honor of a lifetime to do this work. And I just want to brag about something. New Mexico is the only state that lined up all 5 members of Congress to support this effort. The only state. Utah didn't do it. Arizona, Nevada, Montana, no one did it but us. And the only reason we have RECA is because we have 5 amazing members of Congress who understand this history and have been willing to keep this alive when other people told us it's going to cost too much. Imagine telling people who bury their loved ones on a regular basis that it's going to cost too much to take care of us after they harmed us. More photos of us in DC at a press conference. Photos of some of us in Flagstaff, Arizona for a film festival. I'll talk about the film in a moment. So what is RECA and what does it mean? Well, we finally got an amendment passed to the Radiation Exposure Compensation Act in 2025, and it was signed into law on July 4th. The amendment added all of New Mexico. We're very, very fortunate because we're not picked apart by county or by zip code. This applies to the entire state of New Mexico. There's a payment of $100,000 to an individual who meets the qualifications. The qualifications are pretty straightforward and simple. You have to prove that you lived here for 1 year between 1944 and 1962, and that you've had one of the 19 compensable cancers. At our table here, we have all of this information listed so you don't have to try to write it all down. Just pick up flyers from our table. We also have applications available if you want to take one so that you can look it over and prepare yourself to file a claim. There are 19 compensable cancers covered, like I said. You can apply on behalf of yourself or a deceased spouse, deceased child, deceased parent, or a deceased grandparent. The application period is currently set to expire on December 31st, 2027. Please do not wait till the last minute. We've got to start getting our documents together. Getting your documents together is the hardest part. Filling out the application is very straightforward. Thank you. This slide is a little bit dated. I will tell you that as of last week, and I mentioned it earlier, they've paid quite a number of claims, so we need to get that. We need to keep that going. The qualification period, 44 to 62, let me explain that because I mentioned the Nevada test site earlier. 1944 is when our government started doing the first what are called radioactive lanthanum tests in New Mexico. During the Manhattan Project, because they were building these bombs, they had to do some tests. And the first tests, they used radioactive lanthanum and released radiation into our environment. So that's how we got the date set at 1944. 1962 is when they did the last above-ground test in Nevada. We know, because they had monitoring stations all over New Mexico, okay, we know that fallout came to New Mexico from those tests. And I just want to say that very soon we're going to know a lot more about this because a paper is going to be published that's going to speak to how much fallout there was produced by these tests and actually where it went. So the Department of Justice is who adjudicates the claims. And they have recently admitted that they think there could be as many as 50,000 claimants in New Mexico. 50,000. We're nowhere close to that number yet. That's why we've got a lot of work to do. That would mean $5 billion in payouts. So we've got to work hard to make sure that that happens. And I just want to remind everybody, we know the physiological effects of all this, right? It's disease, it's cancer, it's death. But what we never talk about are the psychosocial, social, or financial effects of overexposure to radiation and what happens to you as your family is destroyed one by one. And it was Paul that first brought this to our attention. I remember him saying one time in one of our meetings, imagine the social problems that develop out of people not having adequate resources to address their health problems. And we see it all the time because in rural areas of New Mexico, there's no hospital. You almost always have to travel to get treatment, to get diagnosed and treated. And so what we do know is that New Mexico is one of the states carrying some of the highest medical debt in the country. We have about 2 million people living here. We're carrying $881 million. Almost $1 billion in medical debt. That's not sustainable, folks. It's the leading cause of bankruptcy filings, divorce, and the list goes on. So we all need to work together because our state has suffered greatly as a result of this. So I just want everybody to know, please, 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 if you are one of those people that is able to access documents, don't be a roadblock to people. I'm going to say something right now. The New Mexico Department of Health has been as helpful as they can be. But we have a tumor registry in New Mexico that will not provide us with our own records. Okay, they'll let you know whether they have a record on you, but they won't provide you with the record. And all of the congressional offices, I've already talked to all of you all. You guys need to know, I didn't give up on this effort, and I didn't work for 21 years so that a rogue government agency can stand in the way of the people of New Mexico, Utah, and Nevada, where the tumor registries readily supply people their information, have filed twice as many claims. This is unacceptable, absolutely unacceptable. And I'm going to go to the ends of the earth, I've already said it, to make sure that our tumor registry falls in line and does what all tumor registries do in other places. This is ridiculous. So if you are the holder of a record or somebody who has access to records, cooperate with people. Don't be a roadblock. Why would anyone want to be a roadblock? I had a lady recently who works at an institution that holds records. She actually told me, this isn't going to help me in any way, so I don't know why I should cooperate. At last, let me tell you about our award-winning documentary. Lois Lippman, who is the producer of the documentary here today, has produced this award-winning documentary. You'll have an opportunity to see it in the Albuquerque area on August 30th. Go to their website, firstwebombnewmexico.com, firstwebombnewmexico.com. I think there's some postcards at our table. You'll get to see the documentary on August 30th. If you've not seen it, it's an award-winning documentary. We should get a streamer. We deserve a streamer. Everybody needs to know this story, especially at a time when every day we have to wonder if there's going to be the use of a nuclear weapon in Iran or Ukraine. We live on this really dangerous nuclear precipice, and we're the history of where it all began. We need a streamer for our documentary. I also want to just let you all know that I have been, one of the highest honors of my lifetime will be that at the end of August, I'll be traveling to the United Nations, and they will be having what's called a high-level plenary meeting of the General Assembly of the United Nations. And for the first time ever, in the halls of the United Nations, everybody who will be there that day will hear the words Tularosa and Carazozo and Socorro and New Mexico. And I will be there to tell them the history of what we have been through so that our history is never forgotten. It's the reason we all need to work together to make sure that it is never forgotten. So what can you do to help? Tell everybody about the program. Sign up to volunteer. We need to enlist volunteers in every pueblo. Those volunteers just need to set up maybe once a week to meet with folks. Help them file the paperwork. Help them get their documents in order. It's not a lot of trouble. And once you become expert at it, you'd be surprised at how quickly you can get through it. But we need volunteers in every pueblo to do that. Call the governor's office and let them know that it's not okay that the tumor registry does not supply us our documentation. Those are records that should belong to each one of us. We pay taxes so that that organization exists, and we should be able to access those records without any sort of block to that. And then at our table, we have a sign-up sheet. You can sign up for our newsletter that we publish at least once a month that keeps people up to date. You can also go to our website, which is www.trinitydownwinders.com. Don't just put in the word downwinders, because that will take you to one of the bad actors that has established a website in New Mexico claiming they're us, and they're even telling people, you just have to give a contribution to the downwinders and we'll file the paperwork for you. There are bad actors. Imagine, they know they can get a percentage of billions of dollars, so of course they're here. They've set up shop. They're promising all sorts of things. I got a call from a lady who wanted to thank us for doing this work, and she said, I went with an attorney a year ago and I got my payment just this past week. It took a year, folks, but they're telling everybody, we'll move you to the front of the line. You'll get compensated quicker. We can guarantee results. All of those things are false, okay? Remind everybody, you don't need an attorney, you don't need an outside agency to do this for you. We have volunteers, and it's not a difficult process. You just have to gather your documents, and we're also telling people we highly recommend you do it online. We've known people that have mailed all those documents in. They're sensitive documents, right? They've mailed them all in, certified return receipt, and the DOJ lost them. Not the post office, the DOJ. So please use the online system. That's the best way to do it. And with that, I will end. Thank you all so very much.
Thank you so much for that very informative presentation. It's eye-opening, to say the least. We are now going to welcome the New Mexico Department of Health to speak. Quick housekeeping note, though. Representative Stansberry is here today. She is out in the Pueblo courtyard. Oh, in the patio. So be sure and say hi. If people come in and are looking for her, she is out there, though. So, but with that, I would like to turn it over to you. Thank you.
Oh, I guess I'm up here by myself for the moment. Come on, Department of Health folks, come on up. My name is Amanda Frazier. I'm one of the assistant attorneys, general counsel attorneys at the Department of Health. Also with me is Madison Schaefer. She's the helpline director. She's going to talk to us, you all, about the helpline that we have. And Leo Fernandez, who's with Vital Records, because one of the things that we can do as Department of Health is help you get your vital records to show, you know, where you were born, death certificates, things like that we can help with. And in the interest of time, I'm going to kind of scoot through some of the history because Tina did a fantastic job of covering a lot of that. So I know there's a lot of folks who are also going to be presenting today. So I think everyone here, Tina, like I said, covered the RECA issues. It's a federal law that compensates people who are subject to radiation exposure, and through Tina's and the Downwinders' efforts, it's been expanded from just uranium miners and folks in Nevada to what it is today. So I'm going to move through here because I know we have some time. So again, the expansion has expanded it to everyone in New Mexico, and then there's also expansions for folks in other states. So if you have lived in other states that are covered, in addition to New Mexico, you may also qualify that way. So don't limit yourself to saying, oh, I haven't lived in New Mexico during the time because I was born in Nevada or I was born in Utah. You may also qualify if you were born in one of those other states, in Arizona as well, and Alaska. So it's not just limited to New Mexico. There's quite a few other states that are included. And again, the compensation just includes all the downwinders. And if you qualify for $100,000 recovery. And this is not prorated. It is not adjusted or anything. So what this means, if you have grandparents or parents or children who were affected by this and they have passed, you can still recover on their behalf. So the money would go to you. If it's for your parents, it would be split between yourself and your siblings. If your siblings don't exist anymore, if they've passed, then it would be the children of your siblings. If they have those kids, it would go through that. So don't think because my grandmother passed, I can't collect. You can still collect, and it's not divvied up for each claim. It's $100,000. And right now, as far as I know, they haven't put a limit on how much money these claims can in total be. So like Tina said, this could be a lot of money, and everyone who qualifies will get the same amount of money. And I'm going to jump through this because Tina did an awesome job on that. This also covers uranium workers. And so if you're a miller, a miner, an ore transporter, remediation, you have to have done the work in Arizona, Colorado, Idaho, New Mexico, North Dakota, Oregon, South Dakota, Texas, Utah, Washington, or Wyoming. So again, if you had a family member who was working in this area, they don't have to have been working in New Mexico. There could be a lot of different places. They just live here now. So a lot of people are going to be eligible for this program. And there's issues in Missouri, Tennessee, Alaska, and Kentucky. And I'm not going to go through the diseases because I want to make sure we have enough time for everyone to talk. But the diseases are available through various folks have them available. I'm sorry, I'm a little discombobulated because I'm trying to cut this down. So again, be cautious about supplying things through mail. If you're going to do it through the mail, you can give people copies. You don't have, if they ask for your originals, you can keep a copy for yourself. You can find out about getting certified copies. But again, hold on to the documents that you do have or make a copy of them because they do get lost. Like Tina said, the DOJ sometimes loses things too. And you don't need an attorney to file. And I'm going to have Madison talk about the DOH helpline, which will help you understand things that you need to do and answer questions about that. And I don't know which one is your slide, but I'm going to have Madison talk about the helpline now. Is there more?
Yeah,
Oh, there you go. Okay.
I'm here. All right, so I'm Madison Schaefer. I'm the director for the NMDOH helpline. For anybody who isn't familiar with us, we do a whole lot of things. So we take about 10,000 calls a month, and prior to 2020 and COVID, if you were trying to get a hold of somebody at Department of Health, we had a whole lot of different phone numbers. Depending on what you were calling about, you had to dial a completely different number. Folks were constantly getting lost and ending up in the wrong place. And so with COVID and after, we sort of decided, gosh, it would be nice if Department of Health were a little bit easier to reach for the people of New Mexico. So we built all of those numbers together into one line. So across all the different programs at Department of Health, if you're trying to reach us, you can just call one number, which is that 833 Southwest Nurse number. Makes it a little easier for folks. We do a whole lot of different things. One of our primary functions, sort of the most calls that we get, is helping people with vital records questions. This includes RECA. So I'm going to talk in a minute about what specifically we do with RECA. We also handle a lot of stuff with infectious disease, as you might imagine. And then one of our big goals is getting people connected to healthcare. So if you've never used the helpline, if you call us, we can help folks find a primary care provider. We have telehealth programs to help people with all different kinds of healthcare issues. We'll help people schedule vaccines or find medication if their pharmacy is out of it and they don't know where to look. We just do all these different things. You name it, we can probably help you with it. And our big thing that I tell people is we don't give up. Right? It takes the time it takes. We want to make sure everybody walks away and has their needs met. So if we have to spend 2 hours calling around to find you a pharmacy, something like that, we'll do it. We also are really big on health equity. This also pertains to RECA. We have about half of our staff are bilingual and also speak Spanish. We have a translation service. It does include Dene. For other languages, if somebody spoke a different language, we work very closely with our Office of the Tribal Liaison. We work closely with our Office of Community Engagement, and so we have been able to find folks to translate for us. So how are we helping with RECA specifically? When folks call us, we can give them general information. We get a lot of calls asking what RECA is, how people might qualify, those types of things. As Tina mentioned, the RECA application looks like a whole lot when you first take a look at it. It's pretty long. It's actually more simple than people think. And so we'll take the time to walk through it with people to make sure that they understand what the different pieces are, to help them understand that they don't need to hire an attorney and they are able to do that themselves, and just work with them to make sure they understand all the different pieces. NMDOH, of course, can't determine eligibility, but we can educate folks about what those eligibility criteria are. So if people have questions about that, we'll go over it with them. One of the big pieces of RECA is obtaining vital records, so birth and death certificates, also marriage licenses, divorce decrees, those types of things. We work really closely with our vital records office to ensure that people have clear instructions to make sure that they know how to do that. In some of these situations, Leo is going to talk about this, it's a little bit complicated because people may have records that are under, baby girl, those types of names, or these are older records, so there may be challenges. They may have been born at home and just simply never registered with the state and those types of things. So we work with people to make sure that they are able to get those vital records in a timely fashion and to have their needs met. We get a lot of calls from folks who have siblings or they themselves were born in another state. They need their birth certificates, they need death certificates. We'll connect them with vital records in other states to ensure that they're able to get their needs met and get those documents. We also help folks navigate some of these resources like Family Search, the census documents. Those websites can be a little intimidating, especially for older folks. So we'll walk through those with people to ensure that they're able to have their needs met, do what we can to help there. We also give people information about some possible resources that they can use to prove residency. As Tina mentioned, that can really be a challenge for folks, especially, this was potentially 75 years ago, and people may not have documents from that time period. So we work really closely with them to ensure that they have that information about where to find things. And then Tina did a great job with her presentation of covering all of these things, but it can be really difficult to find medical records from that far back. And so we do what we can to work with people to help them think of avenues to find that. We can help people find autopsy reports, those types of things. So we work closely with people to do what we can, even though there is that 10-year record retention limitation for medical records in New Mexico that can make it a little more difficult. I'm going to talk very briefly about the tumor registry. I just want to emphasize NMDOH and the tumor registry are two different entities. So the tumor registry is administered by UNM. We have no control over what they choose to give folks. Department of Health is doing everything that we can to give people the information that they need out of that registry. One thing sort of to note is that there is a box on the Department of Justice application, the RECA application, that allows DOJ to talk directly with the tumor registry to get the records out of the tumor registry. So that is an option for people. We also are able to look up whether somebody is in the cancer registry or they are not. Unfortunately, we don't have information about their diagnosis. This is what DOH was given by the tumor registry. It's all we've got. I realize it's not a perfect solution, but we are hopeful that we can help people with that if that is a question they have, whether their loved one is in there or not. So we're happy to assist with that. And then I'll just, in the interest of time, we have cards. We have many, many cards. They are over there on the NM Health table. Please feel free to take those, distribute them to your communities, to your constituents. We're here. We're really happy to help folks. We're excited to be working with people and supporting them in this RECA application process. And just to emphasize, all of our services are completely free. So anybody who is calling us for help, we do not charge anything for that. We're taxpayer funded, so we're very happy to help folks. And if it takes a few hours to go through something with someone, we will take that time. So just want to emphasize that. And then I'll pass it over to Leo. If you want to do vital records talk.
We just push down on this thing here?
I think so.
Okay. Okay.
Just push forward.
Just, forward. Okay. Thank you. Let's see.
Fingers crossed.
There we go. There we go. Well, thank you, everybody, for inviting I'm Leo Fernandez with the Bureau of Vital Records and Health Statistics. I appreciate you guys inviting us out so we can kind of walk you through the process of applying for birth and death certificates, and kind of explain, too, that we do a lot more, and like what Madison and Amanda was talking about, we do a lot more than what people think. It's just applying, how hard is it to apply for a birth certificate and a death certificate, right? But we also do amendments. We also do adoptions. We also do paternities. We register cases all the way from hospitals to midwives on that. We also register from funeral homes. So we do a lot of other things other than just issuing out the birth certificate. We are the permanent custodians of these records. I do have to tell Tina, we are not a roadblock. So I just want to tell you that right now. We are the custodians, but we are not going to be the roadblock in this case for RECA at all, okay? So that's why we are partnering up. We have great partners with the OH helpline and our legal team. We are adapting as we go, and we are here to help all of our New Mexicans get through this process as streamlined and as smooth as possible. We have actually cut down our wait times, our turnaround times on applications. We were at 6 to 12 weeks at one time, especially with COVID, when COVID happened. But we brought that all the way down to, I'm going to say that now, is up to 4 weeks. So when you submit your application, turnaround time is normally within a week, but if it's a more complex situation, so it could be up to 4 weeks. But we are working on bringing that down as well. Okay. So I just want to go over a few slides here, so I know we have time constraints here. So this is the discussion topic. So I wanted to talk about how to apply for a birth and death certificate, because that is what most of our RECA calls are coming in as, and our constituents coming into our office to apply for in our office. And we also have 25 other public health offices that assist us with issuing birth certificates only. They do not issue death certificates. So we're going to talk about that with some IDs that you're going to need to apply for your birth certificate and a death certificate. We'll go over our search application, because we do get a lot of questions on how do I fill out this out and who's supposed to be the applicant and who's the registrant on the record that you're looking for. Disclosure of birth and death records, because we do have family members, like immediate family members are always going to be entitled, but we do have not immediate family members applying, so I want to kind of go over that with you guys as well on what our process is to approve those to be issued out. Third-party requests, we do like Tina was talking about, we do have attorneys, we do have third-party applicants applying for the people who retain them for their services. So we want to kind of talk about that and what that process would be. We also wanted to show some examples of the letters that we are issuing out specifically for RECA. If there's any case that where we're searching for your record, and for some reason it was not filed with our office. We don't create the records. Remember that with vital records, they are filed to us. We are the permanent retention on those records. So if we do not have the record, we still wanted to provide some type of documentation that proves that you guys have applied for the birth certificate or a death certificate, and that shows that we did a thorough search and that we're providing you with a certified letter. This is a new process for us. We do have these letters for any situation with vital records, but we are specifically certifying these specifically for the RECA applicants that are calling in for our services with vital records. And then just to let you know what other services that we can provide and how we're partnering up. So this is what I was talking about, is our main office in Santa Fe. This is our address. We were talking about 25 other public health offices that we are partnered up with, so that you don't have to travel all the way to Santa Fe to get your record. You can stop in for your birth certificate at 25 other locations in New Mexico. We also have online services. We have a approved, authorized, expedited services, which is called Vital Check. Now, the one thing I want you to be very cautious of is when if your family members are like that, if you do not Google vital records, because you're not always going to get our specific helpline, our website. So I wanted to make sure, if you do want to apply for a birth certificate or a death certificate online, so it's more convenient, especially if our New Mexicans that live out of state, it's more convenient for them. This is our website, it's vitalcheck.com. There is an additional fee on that, on top of our fees, and I'll go over our fees here in a minute. But then there's our phone number as well. So we do have online services available to anybody else on that, and expedited shipping as well, so if they need it a little bit sooner. So our fees on this one for all birth certificates is searches. I just wanted to make it clear that not always guaranteed a birth certificate. That's one thing is in our regulations, which is why I put that on here, is the $10 is going for a thorough search. We are searching our archives, our vaults, our databases, and we do a very thorough search and a lot of resources involved in that to make sure that we can make sure that we find that record that you're looking for. And that's what the $10 goes towards on that. And it's $5 for a death application search as well. We do the same thing with a death. In form of payments right now, we are taking in our offices and the public health offices, we are taking cash, check, and money orders. We are working in the process right now of taking credit cards in our office so that we don't have to turn customers away to go to an ATM on that. So we're excited about that. So very excited. Yes, modernizing. Okay, so I just wanted to show this was, when you're applying for a birth certificate, we do require that we have a valid ID, driver's license. We wanted to make a list here that we do take terrible IDs, passports, Mexican matriculas, and military ID. Now, in these situations, I still encourage all our New Mexicans to call us. I know every situation is different, everything's case by case, that we can work with you. So especially incarcerations of people coming out of prisons and recovery programs, I know that's going to be very challenging to have an ID. So I just want to make it clear, don't be that as a deterrent. You still contact our office, you contact Madison's helpline, you call that line. They will get you assisted and give you options. And then if they need a vital records assistance, they'll forward it on to us. So this is just an example of our birth record search application. On the top, I just wanted to make it clear, on the top of this application, it is specifically for who's applying for it. It's not the person that's on the record, it's the person applying for it. It can be immediate family, it could be a cousin, an aunt, uncle, whatever it might be, okay? And then the middle section is just showing how you're related. And then the third part over here is the information. This part is very important for us because we need to have this search categories in order to find that record. It helps us, eliminate process elimination because we have millions of records that we retain at the Vital Records Office. So in this case, we would ask for the registrant's name at birth, their date of birth, the county that they were born in, right? Their mother's maiden name, and then if there's a father on record, we would like to have that information as well. Now, don't make that as a deterrent. You just put as much as you can on here to limit it down. We will still do a search with the information that you have. So we're going to make sure you get your money's worth on that search. So that's the birth search application. We have death application as well. Oops, what did I do? Oh, okay, here we go. The death is the same. So the only difference on the death is the date of death, the decedent at the time, whenever they passed away, the name that they had on their record on that one. So, but it's pretty similar on that one. Let's see who there's applying for it on the top. So we just want to talk about who is entitled to a birth certificate and a death certificate. It's, of course, the registrant. If it's your record, you can apply for it. Immediate family members, and who has legal tangible interest in the vital record. So this one on the bottom here, so immediate family members is mother, father, grandmother, grandfather, grandchild, sibling, or spouse. That is what we consider immediate family members. And then it goes in, if anybody else is applying outside that, then we do ask for direct legal tangible, and then we can kind of explain that as we go forward. Legal tangible is if you are not the registrant or immediate family members, could be used as power of attorneys, legal guardianship, it could be for under 18 and over 18. Legal representative, so that's mostly like attorneys if they're representing you and you retain them. CYFD ex parte orders if the child is in custody, in their custody. So this is just some examples of the third-party agencies that we do still require a search application, a notarized letter of authorization from the applicant to notarize the letter from the legal representative, giving them permission to work on their behalf. Letter of justification for the legal representative, contracts or documentation proving affiliation with a legal representative. IDs and credentials, we want to see who's actually applying for this, we'll need that photo ID. Power of attorney, in some cases we'll require that, but not all. So I wanted to put out some examples. So the last one I did work with the library, the last presentation in Albuquerque, so I appreciate hosting that. We got a lot of suggestions or requests to kind of give examples of what we're issuing out to the RECA callers that are coming in and asking for records. And if we don't find them, this is what we are providing. In this case, what Madison was talking about, there's sometimes their baby boy, baby girl. What this means is that it just never, we got it filed in our office from a facility or a midwife. But that means is that it just never got named. So it just, at this point, they registered it and it never got named. At this point, in our regulations, we're not able to release that, even though we are the retention of that record. We cannot release it, and then if they've already been deceased, it's in our laws, we can't amend that record. So we're not able, even though we do have a record, but it's incomplete, so we can't release it until it is, and it won't be able to since the registrant is deceased. So we replied this letter explaining the law, and it gives you demographic information at the bottom here that has all the information we have on that record. So the necessary information that you need. And then we could put that on there, and then of course we certify it with our seal, and then we send that out, okay? And then in the case of we're applying for a birth certificate and you don't have a birth record, and these cases are that there was no birth record, it was never registered with us, and the person is still alive. There's no roadblock there. We can still have a process, it's called a DBR. It's just a delayed birth registration. Anything over 1 year requires documentation to prove that they were born in New Mexico. Okay, so this is another letter that we supplied for. So with this, the reason I put this here is that we don't want this, because this process here could take a while to get documents. It's just like the RECA. You got to try to find proof residency, and you got to prove your birth and where you're born, your parents' documents and their names on it. It's a lot of time taken for that. But we didn't want that time to delay your process for RECA. So this letter should work for you as well, because we did a thorough search, and it just shows that we don't have anything at this time. For any reason, there is no record. So this is the cases where they may have been born out of state. So we do get a lot of applicants that come in and they just didn't know where their family members were born. So we will do a thorough search, and at this category of no record, this will show you the categories that you supplied to us that shows all the information you gave us. We did a thorough search, and we could come up with nothing. But we didn't want to give you nothing. We want to provide you with something, so to provide with RECA application. So this one just shows that it's a no record statement and certified. And these ones I put on here just because we do also have cases that are still being filed. They're maybe just not ready yet. So like I said, they get filed with our office and they still go through the process, like the DBR process of delayed. That may be going through that process, but you may need to know a status. So we have this letter in place to tell you that, yes, we are working on it, but it's still a recent event, and it still has not been registered and filed permanently in our office. I just wanted to give you guys a little bit of data. I know I'm sorry I'm taking too much time here, but just a little bit of data here. This is what we've collected since we started RECA. We just wanted to show the number of issuances here since February, and you can see that we have a steady increase of actual successful birth certificates being issued out, specifically for RECA. We do a lot more than this, believe me. But I also wanted to show a graph here on how the no record statements that we actually sent, that I gave you examples of, is very small. So that's a good thing. That means that we are finding those records and we're giving them out to our New Mexican constituents. There's death as well. We have a steady increase on those ones and a very low amount of data that shows that we could not find the death records that they were looking for. This is a little bit of call data for RECA. This just kind of shows what type of calls that we're going through the New Mexico helpline, and that they were able to, specifically for RECA, coming down on this one, and then just a small amount of this one. That's why this partnership is working great. The small amount that's coming to us for RECA, that means they're very complex, and we have to work through them, either amending a record, doing a thorough search, and then sending them out these certified letters that I showed you. So I just want to give you guys some information that Madison had already shared with you. The helpline available time is Monday through Friday, 7 to 8 p.m. The weekends from 10 a.m. to 4 p.m. Their number is listed here. And our Santa Fe Vital Records office is from 8:30 to 4, operational hours, and our phone number there as well. So resources. This is a very important one because I was telling you before of Googling vital records. There's a lot of third parties out there that are charging a lot more money to our constituents to get records from us at Santa Fe Vital Records. So you really want to write this one down. Is our actual website, okay, so that you can get applications, any information you need for vital records. And then just a couple of our laws that here I wanted to list as well. Okay. I just wanted to tell you too, I did bring in some fact sheets with me today. I didn't have a table to set up on, so I do have some fact sheets and some examples of the letters that you've seen on this one. So if you would like a copy of those, just see me at my table. Okay? Well, thank you very much, everybody.
Thank you so much. It's really reassuring to put a face to all the paperwork and data that you have to submit, and to know that there's actual people out there who can get you that information and get you the right resource and be able to work directly with who you should be working with instead of other third parties. I'd like to now introduce Ms. Gina Grimes from the Nuclear Worker Advocate Radiation Control Bureau. So please welcome her. Thank you.
Hangabaheji. My name is Gina Grimes. I'm a member of the Washoe Tribe of Nevada and California. I also work for the State of New Mexico Environment Department inside Radiation Control Bureau as the Nuclear Workers Advocate. So not only do I do RECA claims, I also file and carry caseload of former Department of Energy workers, contractors, subcontractors, and also uranium workers and survivors. So I'm very busy. Our little office is very busy. So I'm here to talk to you today about the application process and some common challenges that we encounter. So we talked a lot about downwinder. And they shouldn't be lumped together. I know that in talking, we do lump them together, but we can't forget our uranium workers as well. So these are the compensable diseases for our downwinders. There are 19 different cancers. So what is needed to apply? There are 3 elements needed to apply for a complete application. You need proof of identity, proof of disease, and proof of residency. Proof of disease, there are 3 options. There is the tumor registry. I discourage it. I use it as last resort because we don't know what's in there with their reporting. 2 is a certified medical record. And the 3rd option is if it's on the death certificate, the cause of death. And proof of residency, the proof of presence, or proof of residency or proof of presence. That seems to be the hardest one, getting those documents from the 40s, 50s, and 60s. So proof of presence in this state is from September 24th, 1944 to November 6, 1962. These are just some examples of what we can use: tax records, stamped letters, envelopes, a driver's license, home deeds, a warranty, life insurance policies, employment records, church records, school records, diaries, siblings. So if you were born in 1960, 1961, we can use those older siblings. If you have older siblings, we can use their birth certificates, school records, and it works. I know that because I filed for someone in February and they were awarded based on their older sibling's birth certificate. The 1950s census, they're saying certified. I'm not too sure. Might need some clarification if they're taking certified records. I'm hearing different stories on that. Also a Q clearance or a top secret clearance document, and a DD-214, some examples. Inside the application, I know the paper application, it's very complicated, but the online application is much easier. For tribal enrollment, this is an option. You don't have to select it. You can select yes or no. Paiute, I'm also Paiute on my mother's side, and it's actually in the drop-down on the application, so I selected Paiute. You enter your census number, and then they will reach out to the vital records or to membership enrollment office and verify your ID there if you don't have a birth certificate. Another option for proving proof of presence is the National Archives and Records Administration, or NARA. I know we as natives way back then didn't have a lot of documentation. My grandmother herself didn't speak English, so my mom doesn't have report cards and all that documentation. So this is one option that we have. We have the census records, BIA is also in here, BIA records, boarding school records, employment records, and military service records are all on this website. This is under NARA again, administrative records related to American Indian and Alaska Native schools. So this is some of the documents that are contained here from the boarding schools. Journals, annuals, attendance records, correspondence, financial documents, medical records, photographs, registers, reports, school applications, and school censuses. This is the 1950 census. This is what it looks like inside NARA when you click on it. This is a 1950 census. This is an Indian reservation schedule. I chose one here. This one is the Hohola family from Isleta. And it says, I don't know if you can see that, it's pretty small. It says Indian reservation schedule. The next one is from my hometown area of Gardnerville, Nevada. It does not say Indian reservation schedule, so there's two different ones. Same thing, 1950 census, they're just two different schedules of how they appear. Here's a list of the New Mexico boarding schools and the dates that they were in service or in operation. Those records are held at the National Archives in Denver. This next picture I'm going to show you is actually attached to this information on the NARA site. This is from 1910. This is the Albuquerque school, Indian school. These requests can be made online to NARA's general mailbox, denver.archives@nara.gov. The Denver office holds all these records, permanent records created by federal agencies and courts from New Mexico. Also, you can request your military service records online right here. A DD-214 is free to next of kin, and you can also request it by fax and mail as well. In 1973, there was a fire, so some of those records are gone for U.S. Army and Air Force veterans. Those time periods are listed here as well. Another option that we have of providing residency is our IHS medical records. Here is the release for this information. And so let's not forget our uranium workers. I also have invited Phil Harrison here. Phil Harrison, Leslie Begay, Roscoe Scott, and Lucy Scott of the Navajo Uranium Victims Radiation Committee? Navajo Uranium Radiation Victims Committee. And they have worked tirelessly advocating for uranium workers. And I have experience filing some uranium claims, but I'm going to ask Phil Harrison to come on up to help me with that. Also, we have Leslie Begay, is a U.S. Marine, came home from Vietnam, and is a double lung transplant recipient. He was a miner also. But this is Phil Harrison. Come on up. On the screen here are the list of compensable diseases for uranium workers. There are only 2 cancers listed. So what I'm told is that uranium likes the lungs and the kidneys. And so you see these diseases are related to those 2 organs. So our uranium workers are our miners, millers, drillers, transport workers, and remediation workers. And I will let Phil take over from here.
Okay. Thanks, Gina. Good morning, everyone. Phil Harrison, enrolled member of Navajo Nation, and I'm a Red House clan, born around the Four Corners, and coming from Cove, Arizona, northeastern Arizona, and that's where one of the first uranium mining took place from 1950 to 1966, And I so happened to be from that community. I grew up, and my father and uncles they all went to work in that area. Late 70s, this is in a nutshell. I'm going to just really quick go through this, and I don't want to take a whole lot of time. There's just a lot to share. But in the late 70s, around 76, 77, 78, in a duly called chapter meeting, an elderly man named Frank Smith Sr. Brought out the issue of, look, he said, our boys are dying. These are people that engage in mining. We got to do something about that. So a grassroots organization was formed, and I so happened to be there. I was one of the appointed to help to push for compensation. So which we did. We went to work with other members. Some of them have gone, and have new volunteers like Leslie, Roscoe, and Lucy here, Elvin John. So we did that first law with the late Secretary of Interior, Stuart Udall, and our late nomination attorney, Albert Hill. We did the 1990 law, going back to Washington and back. That was for underground only. Then later on, we submitted changes in around about 1994, 95. We got the amendment done in 2000. That's where the EE came about with home care and things like that. What was not included, we were told by Congress to bring it back. So we submitted another proposed changes July of 2009 with then President Joe Shirley and Jonathan Ness. So since 2009, we've been going back and forth, and Tina was right along there with us too, with Trinity, and then other people across the United States, like the Manhattan Project. They all came on board, Kentucky, Ohio, and I believe Texas too. So that took 16 years to get that done in the H.R. 1. So it's been a struggle, it's been a big fight. And now, a year ago, we got this RECA law passed. We're very happy about that. That covers everybody. We help Laguna to form a grassroots committee. So I don't know where they're at with their struggle there, but we did help a lot of people. Now, bring it up to date here. There's a backlog about people that has filed. They have requested Social Security Administration earnings statement. We call it work history. We have people that have been waiting for about 9 months, 7 months, 6 months. We lost 2 minors waiting for their SSA, and their medicals were qualifying. They were ready to file for them, and these gentlemen died. So now we got to wait for their work history, and then we have to refile for the spouse. So again, that takes work. We also there's a backlog of Department of Justice paying out the compensation. And I imagine they're good people. I imagine they're flooded with claims. But I have sent word back to D.C. I spoke with Senator Heinrich's office the other day, letting them know about the backlog of things. But this has been a struggle for us. And we only have the rest of this year and next year to do this. So I think we have some plans about extending the program another 2 years, and I heard 5 years. So I hope that the extension would be made. It's hard to get the work history documented. It's hard to get your diagnosis letters from medical. And I heard about the vital records. We're trying to amend some death certificate, and we're teaching people about telling their doctors what they have encountered mining and milling, that they should tell the doctor that they have lung disease. So if they die from other illnesses, at least under the bottom of that death certificate where it says other significant condition, it can be noted as lung disease or anything that has to do with renal failure. And we're struggling with one right now. We're trying to get the death certificate amended. So this poor widow is waiting for 6 months now from a civil hospital. So there again, I don't think they understand or they're too busy. So we're struggling with the process, and I'm glad that you guys are all here. I'm learning a lot. So I do appreciate the time Gina allowed me. So hopefully that we will get this taken care of, and we're here to help too. My office is in Farmington, New Mexico, and we have a weekly work session in Gallup every Monday. We come to Gallup, all these minors come in, we do intake, order their SSA records, we do medical screening referrals, we bring documents, vital records. So that's what we do. So Monday, we're going to be in Gallup at Lions Club Building. And then for your information, we have to say thank you to members of Congress, the state of New Mexico congressional members. We really appreciate the work that you have all did to help us. So we're going to do a first anniversary of appreciation luncheon and gifts August 6th. In Gallup. So we have an agenda, and we're inviting people, and we're going to serve meals, I think 100 meals. So if you can make it to Gallup to attend that, we're just on that historic 66 highway. We're at the east end, a place called Dickey's. There's a big conference room. So that's what we're going to do. We have to say thank you to members of Congress, and on behalf of everybody, we'd like to do that. So we're going to be there August 6th during the Gallup ceremonial. It's going to start around about 1 o'clock, and I have an agenda, and the time's not made yet. So that's what we're going to be doing to say thank you to members of Congress. So that's about it. Thank you for the time that's allowed for me. Yeah.
Thanks, Phil. So as he was talking about those Social Security wages, one example that I have is a uranium worker that came into my office. He had been waiting almost 9 months for his certified wages to come in. They're about $96 for those wages. It comes in a nice little envelope with a red ribbon on it. But Social Security is promising 120 days. It took almost 9 months for this gentleman, and he is a kidney transplant recipient. Or you can wait, the other option that you have to verify employment is wait for the DOJ to verify that employment with Social Security. Another issue that came up with this particular minor that I had waiting for his wages is that he, sorry, I lost my thought here. I've got so much going on up here trying to get through this. He worked for Kerr-McGee. He worked for Kerr-McGee between 72 and 76. He told me Kerr-McGee destroyed his employment records. So when Social Security pulled his preliminary report, those wages are shown, but it does not show the employer. So we had to wait for the certified wages statement to come in, and it shows the employer. So they say 120 days, but please, if you have any uranium workers out there, get going on those wages, the request as soon as possible. This is what inside the online application, this is what the document looks like. You enter your mine, Barrick, Nevada, or Homestake Mining from the time that you were employed. And then there's a drop down of your employment type, the mine, the state, your job title, the description. You want to be very descriptive on what you did in the mines. And finally, for those that are approved uranium workers, you may be eligible for compensation for an additional compensation of $50,000 and medical benefits under the Energy Employees Occupational Illness Compensation Program Act, Parts B and E. And that program is administered by the Department of Labor. And that's my other job. That's what I do. And these medical benefits are accepted for accepted conditions only. So if you have diabetes, it's only for what you were accepted for. If you're having, if you have silicosis or say pulmonary fibrosis, it's only for those conditions. I work both out of Santa Fe and Albuquerque. My coworker Desiree Lucero works up in Santa Fe. So we file claims up there. We file for free. We don't charge anybody. And we will see it through till the end. We will help you create your account, file all your documents. And back to some of those proof of presence documents, I've even filed, scanned in someone's little eyeglasses from 1954. It still had the doctor's name on them, the original case, and the mom had the optometry prescription for that. And I scanned it in, I copied it on the scanner, and I sent it in as support. So hopefully they're going to get their $100,000. Is there any questions? Does anyone have any questions? No? Okay, thank you so much. Yes, sir, go ahead.
Thank you for your presentation. Just a real quick question. Does this also include
that for rail or is that just for driving, transport?
I don't think it's mentioned in the intern register.
Just a transport worker?
But I did hear that if you were around as a drover or inspector that you live in the mine, and you can file like that. So I'm not sure about your question.
So I can kind of elaborate on this. I'm with Navajo Nation Department of Health. We did, sorry. My name is Quinn. I'm with Navajo Nation Department of Health. We did process one claim for a railroad worker out in Flagstaff. They were processing a uranium. Basically, the uranium was basically compacted in some barrels, and basically you just have to provide the documentation that you were exposed to that specific transportation, but also you have to track down basically your mailing site, see where they had the mailing transcripts and also the logistics portion that would be the qualifying criteria for that. So that's just my first-hand knowledge on that. Thank you, though.
Thank you so much. Yes.
Good morning. For clarification, the tribal enrollment verification, is that proof of ID or can that be proof of residency too?
I know it's proof of ID. I'm not sure if it's proof of residency. Phil, what is your experience with that? About the tribal enrollment verification. I know that's for ID, and there is a question on the application that says if you don't have your birth certificate, we can call the membership. So I'm not sure if that is related to presence.
We had experience about a lot of Navajo people that were born at home. Our wedding took place on the rural area. For birth certificate, we've been sending them to the Navajo Nation Vital Records Office, where they could apply for what they call an AOB, affidavit of birth. And so that's where they've been getting it. On marriages, the same thing. They can pursue through a judicial and apply for what they call it, the marriage thing, the petition for marriage. They could do that too. So we had a lot of problems with Navajo Nation Vital Records back in 07, 08, 09. There was such a low number for Navajo downwinders. We asked why the extreme the separation of things like that. They said it was all related to vital records. So we've been going back out to the community and telling people to update their vital records.
So yeah, I apologize. I'm not sure if that's going to be considered a part of proof of presence or just identity.
Gina, we worked with the Mescalero Apache Reservation, and we actually asked them to develop a document that certified people resided on the reservation, because they do have a census and they do know when you lived on the reservation, and that has worked. I know 2 people that have utilized that out of Mescalero, and it did work. So it's just a letter that their attorney developed, basically certifying that the tribe keeps these records, and they can certify that the individual lived there during which time frame.
Okay, thank you. And I've been filing now for almost a year of these applications. I've probably filed over 100 so far. Go ahead.
Good morning, everyone. I'm Christy Lopez from Mescalero Apache Reservation. You know, with this application thing going on, I started on my late wife's. You know, they asked for everything. I'm still going through the process. You think you finish it, and you go take it back, they'll ask for something else. And especially the medical records, I'm having a hard time getting the medical records for my late wife. And you know, it's just an ongoing process. And I'm getting frustrated. And some of our people that are doing the same thing, they get frustrated. And they just quit on it. So I think, you know, we just, I don't know what to expect now. You know, I just going on and on and on. So, you know, it's hard. It's a hard process doing that application.
Thank you, and I'll talk to you as well after the event is over, sir.
I'm sorry. On his question here, we had similar problems with that, with the spouse leave-in, and especially a marriage certificate. The other thing is medical records was AHS did these changes, policy that they said that you have to establish what they call an executor of the estate, or more or less for the Navajo version, it's a probate thing. So lately, our agency has been doing the ROIs, release of information, and lo and behold, that we're getting their medical records now instead of the individual. So we had some success now that yes, if it's going to an agency, I don't know by attorney, but we don't use attorney. So we've been success about getting medical records. I don't know if the hospital there would do that. So that's something that we're experiencing too.
So Christy, I'm sorry that you're having difficulties, but we'll do what we can to help you. I have a question, and I want to clarify something just so everybody knows. If the death certificate for your wife lists a compensable cancer, you don't need any medical records. I want to stress that, because if the death certificate lists a compensable cancer, that's all you need. You don't have to worry about medical records. Go ahead. Okay, so we'll work with you on that directly, because that is not true. You don't need any medical records if the death certificate. We'll work with you on it. We'll find somebody to volunteer to help you. Our law students, I know, would be glad to help you with all of this. And so we have help. The other thing I'll mention, Christy, do you know any of the council members in Mescalero? I thought so. That's why I asked the question. You guys need to go back to your reservation, and we need to find some volunteers there. We're willing to train them. We'll come in and train them, okay? So that you guys have adequate help, because you shouldn't have to be going through this much trouble. It can be very straightforward and very easy as long as we have volunteers within the tribe. And I'll tell you, Christy, I've volunteered to come over and over to Mescalero and do a presentation there, but I have not been invited in to do that. So let's not go through this any longer. Let's work together to make sure you guys have all the resources that you need inside Mescalero so people don't have to go through this.
Oh, I was going to say.
Good morning, everybody. My name is Brian Lee. I'm with Senator Lujan's office. We have every federal entity who's here to help. And if you get questions from federal agencies and you don't know how to answer them or who to go to, come to us. We have people in IHS who are assigned to us, people in BIA who are assigned to us, people in DOJ, people who are assigned to us who answer our questions, who pick up the phone from us, who will talk to us. Heinrich's people are here. Ben Ray's people are here. Dressel Ledger's people are here. Vasquez and Melanie Stansberry's people are here. We are here to help. We put this law through to make sure compensation happens, and we're going to see it through. We're going to make these things possible. We have a commitment from every person in the state to do this, and we're going to fulfill that commitment on behalf of the entire delegation. We stand here ready to help. We're going to be here till this is over. We're going to answer every question. We have partners that we've established within every region of the state to make sure that we are working with you. We have state people that are responsive to us, and we are making sure that every application goes through has as much, if not adequate, information possible to get them done. We've had only 3 applications denied this go-round, and they were because they were non-compensatable cancers, and we're sorry that's happening. And they're working to fix that. And in fact, we've been hearing from constituents that I have this cancer because of this, and it's not compensatable. We're looking to make sure we can make sure that that's possible. So time's ticking, guys. And if you still have tons of questions, don't be afraid to call us. We're everywhere. I mean, we have district offices in many parts of the state, and if you can't find us, Tina knows how to call me. Tina knows how to call Ben. Tina knows how to call Martin. Tina knows how to call Melanie. I mean, she's got direct access, trust me. So Phil does too. I know Phil's been quite adamant about doing these things, but thank you for coming to the table today and making sure you're a part of this process. We are very, very happy that we are seeing you guys come to the table, making these things possible. And everybody else who's been a part of this process, from the attorneys, from the state departments and stuff, and to the volunteers, thank you.
Thank you so much. We do have 2 more presenters, so I respect the time so that they can bring their information up now. But we will have time after for additional questions.
I just want to leave you real quick with some numbers. As of this morning, there are 18,986 pending downwinder applications. 98 came in overnight. So get in line. Thanks.
Thank you so much. This reminds me of a quote from Lone Man of the Teton Sioux Nation saying, "In any great undertaking, it is not enough for a person to depend simply upon himself." And so this is a great undertaking, and it's inspiring to see how we are working together on this. With that, I would like to introduce Ms. Terry Reynoso, from the branch manager from the Special Collections Library, as we have been talking about establishing residency. Thank you.
Good morning, everybody. Thank you so much for the invitation to speak today. I'm so glad to spread this news and this information with you all. So if you've not been to Special Collections, this is a picture of it right here. It is the oldest public library in the city of Albuquerque and the oldest continually operating library in the state of New Mexico. So the building right here is right after it was built in 1925, but the public library in Albuquerque was founded in 1901. So this little building right here has 125 years of information stuffed inside of it. So as we know, RECA passed last July, but it was this past spring that we started to get a lot of people coming into the library to establish residency. We have a large collection, as pictured here, of city directories and phone books, which is perfectly acceptable for the Department of Justice for establishing residency. But we were getting requests in email, walk-ins, over the phone. In our sister department, genealogy, which is a downtown main library, we were getting duplicate requests. So we all met together, both departments, to figure out a way to streamline the process so we weren't doubling work or not having any requests falling through the cracks. So together we established an online form to request the information. We provide the documentation back as a PDF, which is the requirement for the Department of Justice, and it can upload right online to the application. And it just got a little frustrating for these elders who were trying to teach them how to use their smartphones to scan a document, and we finally said, let's just do it. So where can you find the form? If you go to abqlibrary.org, it's right there, front and center, RECA Residency Research Form. Right there, hard to miss. You can Google it and it will come up. You can also locate it here if you visit our genealogies webpage, which same screen, but you can see just a little drop-down menu there under research, then genealogy. Takes you to the genealogies website, and if you go all the way down in those lime bars, they're actually a dedicated RECA Downwinders Assistance page. This is what it looks like. So it offers a lot of resources, answering a lot of questions, and then the form itself is located here. So this is what the form looks like. There's the web address of the form itself if you want to skip all the other parts. We give a little disclaimer about we are the Albuquerque Bernalillo County Public Library, so that is the majority of our information. A lot of our information is actually print. So we are pulling books off the shelf to find these residencies. We asked to allow 14 business days for response. It's usually way less than that so far. We also list here what we do not provide. So that's school records, birth, death, marriage certificates, and medical records. The form itself, I know you guys have to fill out another form, but it's pretty straightforward, and it eliminates a lot of back and forth we were having with just walk-ins and phone requests. You know how many people they go by their nickname, the nicknames on the vital record, so the form itself just eliminates all that. We do request an email. We will offer print documentation if the person does not have email, but again, we want to give this all to you digitally, so you can upload it to the application online. Also, we retain every single one of the requests and all the documentation involved. We're going to retain this through the entire process because we know how it goes. Things get lost, things in the mail apparently as well. You're going through a million emails and the documentation is lost, so we have it and we will retain it through the whole entire process. This is the second part of the list. We have a little section of, please, tell us anything you think we might need to know. We're having a lot of military that they lived on the base, so to know that really helps the process. So the resources we use: phone books, city directories, Catholic church records, the 50 census, newspaper articles and obituaries, and yearbooks. The newspapers are not a primary resource, but we can use it to back up other resources, especially the 50 census. So if we can get them before or after the 50 census in the newspaper, that really helps. This is just a fraction of what we use. So I will tell you again, the majority of our collection is for Albuquerque, but we are happy to review any request in the state of New Mexico. We will try our darndest, and our genealogy department is way better at finding individual peoples than special collections. We're more about things and places. So we have a great support staff to find, and we will never turn anyone away if we are not able to locate the residency. We will provide you the resources to go to next. There is no one leaving the public library without the information they need or the documentation they need. So again, we do not have medical records, school records outside of yearbooks, and any of the vital statistic certificates. So if you do not know the Public Library of Albuquerque and Bernalillo County's mission statement, it is connecting people with resources and services. So this doesn't mean books or story times. This means a vital part of support in RECA. So me personally, it is my honor to serve my community like this, and I stand by the statement of we will get you that residency as hard as we can try. So here is Special Collections contact information. Take a screenshot of that. Yes, so thank you again, and please reach out. We really, really, really want to help you.
Thank you so much. I am a big library girl fan. I think libraries are amazing and wonderful resources in the community, so thank you so much for stepping up for this important endeavor in the state of New Mexico. Next, I'd like to introduce Ms. Melissa Anderson and Mr. Chi Montoya from the UNM School of Law Clinical Law Program, and they're going to give you some vital information about applying and how they are a resource, not only here, but can be a resource out in your communities. Thank you.
All right, let's see if we've got the technology down first. Great. Hi, my name's Melissa Anderson.
And I'm Shay Montoya.
and we are students at the University of New Mexico School of Law. We are in the clinical law program, which means that we've spent the summer working with individuals and working on RECA. So we're going to tell you a little bit about what the clinic can offer to your communities. And we're just kind of putting our names out here. We're going to keep it really short and sweet so that we can all wrap it up. And if you guys have any questions, feel free to track us down. So, of course, it would not be a lawyer presentation if we didn't say that we are not your attorneys and this is not legal advice. So, all right,
And I just wanted to also say, like, as NMDOH was saying, like, you don't need attorneys to file RECA applications. And I think that's something important for people to realize because they see the application process and think how complicated it is and you have to hire someone. And, like, we just need dedicated people of the community to, like, help with these things. So everyone that is a student at the UNM School of Law has to go through clinicals. And what clinicals are a practical application of becoming a lawyer to experience what it's like. And so as part of that, what we have to do is a special project. And so the special project that we have chosen is to help people with RECA applications and RECA claims. So what that looks like is with the School of Law, we'll have people come in and they'll talk to us about the RECA applications. We'll take emails from them and generally help them out with filing RECA applications. So yeah, it's something that we at the University of New Mexico Law School do and participate in and want to help our community with.
So just to do a very quick overview so that you know what to expect, the people who are working on RECA are students. We're student attorneys, so we're like put into the bar under a special rule for a short period of time. But we are supervised by a licensed attorney. This is Professor Nadine Padilla. She is the attorney who is supervising the RECA project and started it back in September of '25. So if you see her out on the street, tell her that we did a great job. And the project has kind of morphed into a two-armed, a sort of two avenues that we want to help people apply for RECA and spread awareness and help our communities. So we're going to talk a little bit about that. I do want to say that I know that people have reservations about working with students. I know that for me and for Shay, that this is something that we are very passionate about. Students might be the dumbest attorneys that you've ever met, but they are also the most hardworking and really, really care about their clients and about doing the good work. And so I definitely encourage you all to overcome the, the initial like, wow, these kids, they're so young of it all, and let us have the honor of assisting you. So, so you want to talk about the one arm?
Yeah. So as one of the things that we as the law school want to do is go out to the different communities, go out to the Pueblos and all the communities throughout New Mexico and do community outreach workshops. And so in the past, we've already done two of them. One of them was at the Acoma Pueblo back in November of 2005. And the other one was at the main library here in downtown Albuquerque in April of 2006. And generally what we do with those workshops is start off with like a presentation similar to what has been given to everybody today, with informing everyone on what RECA is and the resources and how to file applications. And then afterward, there would be an opportunity for all of the students to meet with any community members that are filing RECA applications to help them actually file these applications. We sit down with them. We could answer questions about specific things that they're struggling with applications, getting the application started, and we also just go through and help people file the entire application. So that's what we do and what we want to do with the outreach to the different communities.
So the second arm and kind of what we've been developing this summer in the clinic has been the individual assistance. So we've had several people who have come from the Acoma Pueblo presentation who the first time that they interacted with the clinic was there. They sat down, they, talked to a student about their claim and about what documents they would need to gather. They've spent the last one family spent about the last 10 or 11 months gathering all those documents. There were 12 siblings, so it can get to be a really heavy lift when you have a lot of people that you have to account for. But I know that technology is a big barrier for the application process. I personally don't love using technology, but what I dislike even more than that is sending my original documents through the mail. And so, yeah, oh my gosh. So one thing that we've been doing this summer that has been really satisfying for us and I think really helpful for people is that if you come into the clinic, you've got all your documents or, everything that you have in the moment, what we have been doing with people is going ahead and scanning all of those documents in with our big fancy printer scanner monstrosity. We put it in a file. It's secure, it's safe, it's confidential. And then once we have everything that we need, we go ahead and we sit down with the applicant and we go ahead and we create the account for them. We link it to their email so that they're the ones who are getting all of the follow-up from DOJ. And then we go ahead and just do the online application right there. And then we're able to upload the documents and connect them and be available if, if they get a kickback from DOJ or a request for more information, we're always there to keep following up. But that has been, I think, really helpful for people because scanning things can be challenging and dealing with, is it a PDF? And it cut off half of my birth certificate. It can be really stressful. So we are definitely available to people for anything from just answering a really specific question to scanning all the documents and submitting it together. So that has been a really cool thing that we've been able to develop. And we are really hoping to push the community education arm of our clinic project this fall so that we can also get more of those individuals in and get more of those applications filed. On that note, we want to hear from you. Yes, as Shay mentioned, we are willing, able, and very excited to come out to your community, wherever it is. We'll make it work. I know that one thing that we're trying to make it down to Zuni in the fall for a couple of days. We would also like to, I think, get with Tina about training people in the community as well. So, yeah, that's what we're doing. Anything to add?
Yeah.
Here?
So one of the last things that I wanted to add is when we go out to do these community workshops, I was recently just talking with Miss Osterla. I hope I'm saying that correct. Osterlo. And the New Mexico State Libraries is a great resource because they have connections throughout all the Pueblos with the libraries that are on the Pueblos. And so having the resources there already in the communities helps out a lot, and we can use those facilities to create our community outreach, to help people, and to continue working on this in the different communities that we all live in. So,
I think that's all.
yeah, that is everything we have. So thank you guys very much for having us. What do we do about this?
I think just leave it.
Okay.
Thank you so much, Melissa and Shay. Apologies for mispronouncing your name. Just a quick housekeeping note. Ms. Kay from the I'll get this right, Radiation Control Bureau wanted to let you all know that she has radon test kits with her. And so please see her, she's right here in the purple. And so please visit her if you like more information on those radon test kits and to pick some up. And with that, I would like to introduce Brandy Ami with the City of Albuquerque for a quick note on what the city is doing on behalf of this endeavor. Thank you.
Thank you, Alicia. I'm just going to get out of this real quick. Like Alicia said, my name is Brandy. I am the liaison for the Office of Native American Affairs for the City of Albuquerque. If you didn't know that Albuquerque has an Office of Native American Affairs, it is fairly new. I like to say it is still a baby. We sit underneath the Office of Equity and Inclusion, which is a whole office that oversees and helps to work with our community and different demographics to make sure that they have information, that they have the resources, the connections, and also to try to make it simpler for folks to be able to utilize the resources that the city has. One of the benefits that I have of my job is being able to work with so many amazing different individuals like the district and bringing all of this together. And so what I would say is that if you are trying to figure out the best place to find this information, sorry, we just made this live this morning, so I'm trying to get it to pull up the web page, but it's searching instead of pulling it. The city is able to host and create sites that are able to collaborate the information in one space. One of the things that I worked on was for the libraries to have a collective resource in order to be able to share this information with one another. Sorry, I'm just going to have to go through my page. The link should work in, oh, here we go. You just need to scroll down a little bit. The link should work. The only thing that you might not be able to see it is in Google because it is live today. It hasn't had enough searches in it for it to come up actively. So you'll want to use the cabq.gov/RECA. And what we've done is we've created just a brief snippet for folks to be able to see how they can navigate the library resources. What we saw is that our libraries are this beautiful opportunity to be able to utilize this knowledge and access resources. So we've tried to collectively look at the regions of New Mexico and seeing which libraries are able to actually support, because some have limited capacity. Some don't always have the same access to different resources. So I've touched base with most of the libraries that I can at this point, and we've compiled lists of what they actually have available to them as well, so that folks can go to the site, take a look real quick, see if this is someplace that they can reach out to, at least as a starting point, and then navigate from there. But we also have the connecting points of the Department of Health and the New Mexico State Public Library as well. So we're also actively trying to compile the resources. More than likely, we'll add UNM to this list as well. But we do know that there's a couple different places that people can find information. So we're doing our best to try to make sure we collaborate and put it in a place where people are able to access the information. But really, of course, as the Office of Native American Affairs, my main focus has been getting this out to the tribes, making sure our tribal communities are aware of how to get this information for free, because we know that this can be a challenge and an issue for those that haven't had the access, or they maybe don't know where to start. So the biggest piece for me is to make sure that everyone's able to connect and know who to talk to, and they're getting to the right individuals. So as the city, if people are calling me, I'm redirecting them back to the right individuals to speak with. My office specifically doesn't have the opportunity to help with applications. I'm technically an office of 1.5. We have one other individual, our intertribal governmental liaison, Terry Sloan, who does support, but like I said, for me in the city, my main goal is making sure that we host and have a space for those that are living in the urban setting to understand where to navigate. And later on, we will have this recording available, posted as well. So the city of Albuquerque has a great team that we call GOV-TV. They will record presentations for us. They will provide all of these recordings for free for the public, for public use. And so once this link is available, it will go on the website, and we'll share it with Department of Health and other folks as well, so that you can continue to share this information. We want to put it in a platform that is readily accessible for folks, and they don't always have to go somewhere to be part of an info session. That's one of the biggest challenges we see with our rural communities is transportation. They're not always able to get to places to get the information. So I'm trying to think of this very dynamically from myself being a Pueblo person living on the reservation and understanding what those challenges can be. I'm trying to do my best at the city to make sure that we find and help the resources get to the best place possible for the folks so that they can move forward with these claims. Like we've stated before, the current timeline is December 31st, 2028 for the applications. That might change, like they've been saying, but we want people to get this started. We want people to move forward. We want there to be as minimal barriers as possible. So please continue to reach out to the folks in the room, utilize the resources that are here, make those connections, get the cards, set up the sessions in your own communities so that you can reach your tribal members. But that's what we're really trying to do from the city standpoint, is just make sure that everyone is connected and has the proper resources to move forward. So that being said, like I said, the website is live. So if you were to go to cabq.gov/RECA, this is the page that you'll land on. If you are somebody that wants to be listed as a resource, just reach out to me. My email is bahmie@cabq.gov. I'm back at the table over here behind the video, and I have cards. So you can reach out to me as well if you need additional information or support. So again, we're just here to try to make sure that everyone has all of the information, because we don't want anyone spending money on things that they can get for free. And we want our community members to receive all of the, for all the things that we've experienced. We want our community members to be compensated. But for all of those that are here in the room filing on behalf of your deceased loved ones, I just want to take a moment to acknowledge you as well, and to say that I cannot imagine what this is like to consistently try to fight for what you are earning, or not just earned, but deserving of, because of what the government has done. So I just want to say that we are all here coming from a place of love and support, and we all are trying to do as much as we can, because I know that coming from Laguna, having our largest the largest open uranium pit mines in my own community, in my backyard, my parents have been affected. Our communities are continuing to see this fallout, and that's why I've pushed, myself so hard to work to support this effort, because all of New Mexico has been impacted in significant ways, but I feel like our tribal communities have been at a disadvantage for a very long time. So thank you again for showing up, for being present, and for taking a time out of your day to listen to all of this information. Please volunteer if you can. We need as much support and people on the ground as possible to make sure that these claims are going through. Thank you.
Oh, my God.
Okay, thank you so much for your attendance this morning. It is really amazing what's been said here today, and the good feelings, the positive energy, the collaboration. It really reflects a commitment to learning and strengthening tribal and Pueblo communities, and addressing something that should have been addressed many years ago, and bringing healing to this time in this space. So very, very grateful for that. So thank you so much to our presenters. One last round of applause for all our presenters. They were just wonderful. These stories were inspiring to me, and I hope that this is the jumping off place for continued collaboration and reaching out to everyone that was here and utilizing the online resources. And thank you again to the City of Albuquerque and GOV-TV for putting this out here. With that, we will close this meeting today. Because Kyle and I are overachievers, we have another meeting right after this. And so you're going to see a lot of movement as this meeting ends and another meeting begins. But again, we're here for you. Please email us if you would like more additional resources and information, and we're happy to send that out. Thank you again.